Visual acuity after retinal gene therapy of choroideremia. Definition: choroideremia is an incurable genetic disease that causes blindness in men and affects approximately 50,000 people. This disease is caused by the defect in the CHM gene, which is located on the X chromosome, and this is why this disease affects men and women differently. Women have two X chromosomes, and so normal CHM gene on the X chromosome can compensate for a defect in CH gene on the other X chromosome to some extent. Men, however, only have one X chromosome. There are currently no effective treatments available for choroideremia, but it have developed a new technique of gene therapy which believed may help to slow or even stop the degeneration. It involves putting normal copies and the effect going back into the cell's retina helps.
It is a form of blindness that some call especially cruel. People with choroideremia are born with perfect vision, but then they start to lose their sight. Researchers in the U.S. are building on a clinical trial overseas, and they're about to test a therapy designed to stop the disease and maybe even reverse some of the damage. In bright daylight, 10-year-old Mark DeVoe has no trouble seeing his friends.
I'm going to pick now.
But inside, or even in the shade, Mark's eyes sometimes don't work.
I have trouble seeing like trees, when the road ends, and when there's like a drop there.
At age 6, Mark's doctors diagnosed him with the genetic condition choroideremia, which causes people to progressively lose vision until they're completely blind.
I don't know what it's like to live in darkness, but I've seen it.
Susan is a carrier of the blindness gene. Mark's grandfather has the condition.
Watching my father go blind was devastating. As a little girl, you count on Daddy to do things, and Daddy couldn't do them.
Dr. Jean Bennett is one of 2 U.S. researchers preparing to test a gene therapy for choroideremia in humans.
I think gene therapy holds a huge promise for developing treatments for blinding diseases.
Researchers will use a virus carrying a normal choroideremia gene and inject the virus just under the retina. The gene should begin to work in a few weeks. In a trial of 6 patients in the UK, all 6 had better low-light vision 6 months after the therapy. 2 of the 6 could read more lines on an eye chart. Dr. Bennett says early success in the UK is encouraging.
If we can prevent the disease there from continuing, it would change people's lives.
I want my son cured. I want to see all these guys who it breaks my heart to see walking around a conference with white canes. I want them to have freedom.
And a chance to enjoy all the fun that comes along with being a kid.
Pros and cons. The researchers report on the patient's serum 3.5 years after treatment. Patient 1 and 4 had advanced disease baseline, with a study at several lines below normal on the early treatment of diabetic retinopathy study chart. By 3.5 years, visual acuity in the treated eye on the patient 1 had increased by 21 letters from baseline. In patient 2, it increased 18 letters. Meanwhile, vision in this patient untreated eyes continued to decline.
If you're suffering from an incurable disease, to be told that there's nothing that can be done and no one is doing any research into it is one of the worst things that we can possibly say. At least if I can say to people, there isn't yet a cure, but we're working on developing a cure through this clinical trial, it just changes their whole concept. It gives them hope. Choroideremia is prevalent in about 1 in 50,000 people all around the world, as far as we know. And these people go blind. It affects men, and the reason they lose their sight is because they're missing a vitally important gene which is at the back of the eye, and it's important for keeping the eye healthy. So what we're doing with our gene therapy research is that we're actually using a virus, a tiny viral particle, to deliver the correct gene back into the cells at the back of the eyes in these patients. The eye is a fantastic target organ for gene therapy because the genes that cause retinal degeneration are well documented. There are plenty of them, and we can know exactly what single gene to put back. The other thing is that we have a control eye, so we can look at the degeneration in one eye and see how it changes compared to the other. And although it's a little bit early to talk about the results that we've seen so far in terms of visual improvement have been very, very encouraging. The disease itself is relatively rare, but the concept of what we're doing, the technology, everything we're doing in this trial will be relevant to other causes of blindness, and we can think of retinitis pigmentosa, which is a disease that causes blindness in about 1 in 4,000 people in the UK through similar genetic mechanisms. And also potentially age-related macular degeneration, which has similarities to choroideremia in many ways, and it's a disease that causes blindness in 300,000 people in the UK, and is increasing each year with the increase in the elderly population. One of the benefits of being in an academic research rather than a sort of a pharmacological company or something like that is that we can be open and collaborative with our work. There is no financial incentive for us in what we're doing. We're all working together for the same goal, and I think that makes a very, very good working environment. It's fantastic to see the realization of what I've been working on for many, many years. But we're not just talking about technology. I mean,
Isha Plainaker. The gene therapy for choroideremia is still in study as has not been tested yet in this treatment in Ecuador. Application in medicine. In order to administer the gene therapy vector known as AAVV2, the eye's clear internal jelly must first be removed by a type of keyhole surgery known as vitrectomy. This procedure is quite safe, and the eye clear internal jelly is gradually restored by the body in the weeks following of the surgery. After the vitrectomy, a small volume of fluid contains the AAV2-Rep1 vector is injected underneath the retina through a very fine needle that is narrower than a human hair, creating a small fluid, a blister or blur under the retina.
A novel gene therapy developed by Oxford researchers may restore vision to patients with a previously incurable form of blindness. Choroideremia is a rare genetic disease in which photoreceptors in the retina and underlying vascular layer, known as a choroid, degenerate. Degeneration of the retina and choroid begins during childhood and develops into blindness in old age. Choroideremia is caused by a defective CHM gene. In the gene therapy, a functional copy of the gene is inserted into a virus vector. The vector is then used to deliver the gene to the degenerating photoreceptors in the retina. Six of the 9 patients enrolled in the therapy trial have reported
Conclusion. Best corrected visual acuity is a reliable marker of visual function, in contrast to Leber congenital amaurosis, in which visual acuity is generally profoundly affected early in life. Choroideremia and multifibrinotic pigmentosa are characterized by progressive loss of the visual field, with the visual acuity remaining close to normal levels until the first stage of disease.
Choroideremia is a rare genetic disease in which photoreceptors in the retina and underlying vascular layer, known as a choroid, degenerate. Degeneration of the retina and choroid begins during childhood and develops into blindness in old age.